February is American Heart Month, a time to focus on our heart health and take action. It's important to point out that heart disease is a leading cause of death for men here in the U.S. So what can we do to try and reverse that trend? Dr. Atul Chug with Franciscan Health is here to help us out. Thank you for being here.
Thank you for the opportunity, Dustin.
So you were telling me that something as simple as having your blood pressure checked can really be an indicator of problems, right?
Absolutely. I mean, when we think about risk factors for cardiovascular disease, high blood pressure really ranks as the top modifiable risk factor that we can think of that can really help a person not only regain some longevity in terms of their heart disease, but frankly, events like heart attacks and strokes. And the mechanism of it is actually quite interesting. So as the blood pressure inside a blood vessel is a bit like water going through your garden hose. Imagine if that water going through the garden hose is coming in with greater velocity and exerting more pressure onto the walls of your garden hose. That causes damage to the vessel, right? Same the way that would cause damage to the garden hose over time, right? So by decreasing the blood pressure, what we do is decrease this process of atherosclerosis, which is driving cholesterol and inflammatory cells into the blood vessels of the body, which of course if that accrues in large proportion in the heart, that would cause heart attacks. If it happens in the brain, those would cause strokes. If it happens in the peripheral vessels, for instance in the legs, that would cause peripheral arterial disease. So these events over time can really do a number on a patient's just general quality of life and frankly how long they live. So the blood pressure is a major factor that drives those events over time.
And at what point, when you get your blood pressure checked, at what point is it too high and you have to take action?
It's a great question. In general, we consider 120/80 to be normal. However, there's sort of a gray zone between 120 and 130 on the top number that we sort of think of as being places and times when we can actually look at potentially lifestyle modifications, whether it be salt reduction, weight loss, etc., before we start thinking about having someone be on medications. But once considered hypertensive, which is be above 130/80, we then sort of think about potentially thinking about medications as being a remedy for that or a treatment for that.
Obviously, the first part of getting well and getting our blood pressure down is modifications in our diet, maybe some exercise, but medication can and does help, and there's a lot out there.
Absolutely, and that's what's so fascinating about high blood pressures, right? I mean, we've had medications out that treat high blood pressure since the 1800s, and technically even before then, right? And when we think about sort of ancient texts and things that can bring down the blood pressure, at this point there are about 160 plus formulations that can decrease blood pressure.
Wow.
What's fascinating though is that the 50% of our population is going to be off of some or all of those medications by 2 years after the diagnosis of high blood pressure.
So we take it and then we get off of it.
Right. Now,
why?
Multiple reasons. Now, as there are side effects to every medication, as you know. So there's an issue of just, having the side effects from medications. And now as men, one of the things that we're always a little embarrassed to talk about is sexual dysfunction, right? Is, sexual performance. Some of the medications that are out there will, of course, and can, affect sexual performance and can be quite embarrassing. I mean, frankly, it's something that I have to draw out of patients. Hey, how are things going with the home life? I have to come up with euphemisms.
It's not an easy conversation to have.
No, it's not. But I think it's an important conversation to have, and to have that level of comfort with your provider is so critical, because at the end of the day, by not taking these medications, not driving the blood pressures down, you're exposing yourself to higher risks of heart attacks and strokes, which is the last thing you want. Not to mention that we've got so many choices today.
So if one drug doesn't work, there may be another one that does, that has different side effects.
Absolutely. Yep. And that's the nice thing about this, right? There's some medications out there, when we look at the side effects of these pills, and we compare them to, say, placebo, which is a sugar pill. Some of the medications that we have less side effects than the sugar pill in clinical trials. So why not use those? The other thing that's sort of interesting about high blood pressure medications is that not one pill is going to be enough for some patients. Let's give you an example. Patient comes in and on average, the blood pressure is 160/100. Now we know on average, even our most effective pills will drop down the blood pressure on average. The top number will drop by about 10, the bottom number will drop around 5. That's sort of the average of what you will. Now, just to get that patient to 130/80, right there, I've already made the calculations, you're gonna have to be on 3 pills. Not to mention the supplements, not to mention the other things that you're on. Now, your medications are not just taking pills. For some people, it's like a snack or a meal because you're taking so many medications at the same time. So the point is, there becomes pill fatigue. And so what we want to do is try to come up with a formulation or try to come up with things that would help a patient have less pills in the pill box. Sometimes combinations help. Sometimes lifestyle changes can help. One of the greatest sort of interesting changes that we've seen in medicine in recent times has been this dramatic decrease in weight loss with these new agents called GLP-1 agonists. And I suspect you've probably heard about this. These are the medications like Ozempic and Wegovy, and of course the on the other end is Mounjaro and Zepbound rather. These agents not only decrease the weight, but they also decrease blood pressure. Now, in general, we think of, on average, 1 pound of weight loss, on average, will probably decrease the blood pressure, the top number, by about half, half a point on the systolic side. So if you're, so say, for instance, 2 pounds of weight loss would translate to one point of decrease in the systolic blood pressure, on average. Now, we've seen that shift all over the place. Depending in some patients, we see very dramatic decreases in blood pressure as they lose weight, as they lose the weight on these agents. So the interesting thing is that that's a strategy that we've been using now, that a weight loss agent can actually work as an antihypertensive, which has been a really interesting time, for us. It's a very interesting era in the treatment of hypertension. Again, there's a lot of options out there. Now there's a procedure called renal denervation, which actually is a procedure that can decrease the blood pressure, in which we go into the renal arteries and deactivate the renal nerves, which actually help innervate the renal artery, and by doing so, we can actually decrease the blood pressure that way. So for folks who really have difficulty in tolerating medications, that's another interesting way of doing it. There's an interesting drug in development now that's an injectable. Once every 6 months, you go ahead and inject yourself. It's a decrease in the blood pressure.
Well,
so now you're
a year.
Yeah, that's exactly right. Yeah. So my point is, that was a really interesting story when it came to lipid management for the reduction of LDL or the bad cholesterol. But now we're seeing the same story in hypertension, and that's going to probably come to market fairly soon.
What I'm hearing you say is, if I'm a patient and I'm going in to see my doctor, I need to ask questions and tell him or her if something's not working, or I don't like this, or I'm on too many pills. I need to advocate for myself and say, is there anything else out there to help me?
Yes, that's certainly going to be an important piece of the puzzle for any patient.
Yeah.
Be your best advocate. But you also have to make sure that the provider that's in front of you also knows the entire toolbox, right? You need to know, someone who's sitting in front of you really needs to know what's at the entire armamentarium. And I've got to be honest with you, hypertension, the treatment of hypertension, everyone thinks they know what they're doing with it. But the fact of the matter is, it's become so specialized, particularly in the patients who have resistant hypertension. In other words, not at goal despite being on 3 medications or more. Those are challenging patients. And I would argue to those patients, go out and see a hypertension specialist. See someone who really knows what they're doing with this. Because if you go to someone who doesn't, you can really be exposed to risk for longer periods of time. And the next thing you know, you're having your next heart attack or stroke.
And it really, to bring it full circle, it really just starts with something as easy as getting your blood pressure checked. And you can do that anywhere. You can buy something, you can go to the drugstore, doctor's office. The point is, have it done, know what that number is.
Agreed. Also, to a caveat to that is, you can really have some really bad numbers driving your management too. So the ideal time to take your blood pressure is not after you've just had a run or after you've had an argument with your wife about something. Sit in a chair just like this, have your arms nice and relaxed to the side, sit there for about 3 minutes, just relax.
Okay.
Make sure that the arm that you're taking it is raised a little bit at the heart level. Take the blood pressure once. Don't even look at the numbers. Relax for 1 more minute. take the blood pressure with an automated cuff. Make sure the automated cuff has been already well defined by the AAMI, which is the American Association of Medical Instrumentation, that knows exactly which instruments are actually reliable, which ones are not. In general, wrist cuffs, not very reliable.
Okay.
You really need to know how you're using it, and of course you've got to make sure that they're calibrated, so you actually test them against other instruments out there that you know are reliable. Take the blood pressure without, again, if you're a smoker, no smoking, don't have your cup of coffee. Really need to have numbers that are reliable so you can act. Because at the end of the day, if I catch you at a bad day, Dustin, your blood pressure is going to be 2 over 100. And that's not going to, and for me to put you on 7 pills at that time is going to be the bad thing to do. You just need to make sure that the numbers that we're using are actually have some veracity to them.
Well, this has been fascinating and really insightful. Dr. Chug, thank you so much for being here.
Thank you for the opportunity again.
Appreciate
Dustin.
it. Yep.